Friends, we are again meeting on the subject Miasm. This is corollary to the statement made in my earlier episodes regarding the working principle of homeopathy, whether homeopathy is a science or not, and number 2, the various conditions in which homeopathy can work very well, where how does the mind plays important role. So today we are talking about miasm. Many of you may not be knowing the homeopathic miasms because you would have taken medicines but would not have would not have entered into the scientific vast field of homeopathy. In the Indian Ayurvedic system, there is something called Vata, Pitta, Kapha. Similarly, number of miasms are expressed in homeopathic like psoric, gonorrheic, and psychotic. Well, it will have its own further branches, but they are very important in deciding the medicines to be administered to a patient. It will be based on the miasm what he possesses. And this miasm is not a permanent feature. You have corrected and then a mixed miasm emerged. You have corrected that. The combined miasm emerged. You correct that. In other words, miasms will be subject to changes. As the doctor, as the homeopath intervenes, that the miasm of the individual will also take a change. Today, you would have been put in a bracket of medicine phosphorus based on the miasm, but tomorrow he may not respond to phosphorus because he has already crossed that barrier and he is now reached in another barrier. Similar number of situations are there, but for your well-being, all those things are infructuous, and I am not dealing very detailed in forthcoming episodes because you must know what is it, what it could be. When I tell you that maintain your economy, it is not the pocket economy, the state of your health, that is the economy. Your vital force, that is the economy. Okay, so some differences in the meanings. Homeopathic nomenclature is different from the common understandings. So, why this miasm is important? While treating a patient, normally we put him to a bracket of such and such miasm, a syphilitic miasm, a psoric miasm, and it all have its own mental spheres. A lot of work is there. It is not simply giving these sugar pills. You have to understand the patient, his symptoms, his method, his miasm, and his constitutional remedy. All those comes into picture. What is constitutional remedy? Based on this miasm or his peculiar symptoms, a constitutional remedy is selected. For example, a child with a narrow chest and a feature of a little bit of tall than other equivalent aged kids is put in tuberculinum. Tuberculinum is the remedy for such people to correct the constitution tuberculinum. And bacillinum will also have almost all the virtues of tuberculinum, but it is distinguished based on the skin pattern, the itching, the temperament. It as I have told earlier, like glanine and belladonna, here also the differences will come. Ultimately, the correct medicine can be arrived at only after analyzing each and every aspect of what the symptom has presented, what the patient explained, what are the modalities which aggravated your symptoms or feeling better with the symptoms. Yes, now you know when homeopath asking you certain questions, you may feel it is irrelevant, but please mind it. He is trying to extricate some of the vital information for your good. Please cooperate. Okay. And when, especially when the homeopath introduces a ladies, very unpleasant aspects may crop up. So in advance, you please tell the people, the relatives, the patients, the possible questions what may face and why it is being asked, so that there is no confusion. All right? Now, once that miasm based, once that constitutional based remedies are selected, half the job is done. Then only supportive medicines are needed. And that will also be based on so many factors, and out of which modalities are one of the main factors. What is modalities? Also I shall explain in very simple form, not in the class tutorial form, for the average public to understand. My next episode is covering this aspect, the modalities. So till then, Sukumaran.